how to use a CPOT on a patient.
The nurse looks at the patient's face and body for 1 minute to note any visible reactions. At the end of 1 minute, she gives a score for all items except for muscle tension. The nurse then holds the patient's arm in both hands, one hand at the elbow and the other hand holds the patient's hand. She then performs passive flexion and extension of the upper limb and feels any resistance. If the movements are performed easily and there is no resistance, the score is 0. If the movements can still be performed but with more strength, thus indicating resistance to movement, the score is 1. If the nurse cannot complete the movements due to strong resistance, then the score is 2. As a patient is being turned, the nurse looks at the patient's face to note any reactions such as frowning or grimacing. These reactions may be brief. As noted on the CPOT photos, a score of 1 consists of a tense face, which is usually exhibited as frowning or brow lowering. A score of 2 refers to grimacing, which is a contraction of the full face, including eyes tightly closed and contraction of the muscle of the cheeks. The nurse also looks at the body movements. For instance, a patient may be trying to reach or touch the site that is painful. This would be a score of 1. If agitation is included in the patient's movements, this would be a score of 2. Ventilator compliance is assessed by seeing if the patient is coughing and if the alarm is going off. If the patient's coughing and the alarm stops spontaneously, this is a score of 1. A score of 2 would be if the patient fights the ventilator. If the patient isn't intubated, you will hear or may hear certain sounds, such as moaning or crying out. Muscle tension can be felt by the nurse if there is resistance to movement. A score of 2 is given when the patient is resisting and attempts to stay on his or her back. The patient could also clench their fists.
Let us now have you practice using the CPOT on 3 different ICU patients. You will be seeing 3 different video clips demonstrating different patient behaviors. Using the CPOT tool, which was provided to you as a handout, assess and score the 3 different patients. Here with